New speed limit signs are officially going up along I-465, and as of today, most of the interstate loop is now 65 miles per hour instead of 55. INDOT sharing this video of the installation, which should take about a week to complete. So with speed limits going up, police are now cracking down on reckless driving. State Police and IMPD just announced they are stepping up traffic enforcement on highways and city streets. They're using data to identify high crash areas, then utilizing a special enforcement squad to focus on identifying dangerous driving in those particular areas. They're also working with the Marion County prosecutor, who said today the increase to the speed limit is not a free pass for reckless and dangerous driving. We will continue to work with law enforcement to ensure those who jeopardize the safety of others are held accountable. And another law taking effect today impacts one of Indiana's Medicaid programs. The Healthy Indiana Plan, or HIP, gives health insurance to Hoosiers between 19 and 64 years of age. Our Emily Longnecker joins me in studio tonight to explain what's in this new law and how it works. Emily?
Well, Scott, we heard a lot this past legislative session from Republican lawmakers about how much Medicaid expenses had grown in Indiana, almost overtaking how much the state spends on education. This law, Senate Enrolled Act 2, is an effort to slow that growth and curb those expenses.
Close to 650,000 Hoosiers are covered by HIP. Those are the latest May numbers from the Indiana Family Social Services Administration. The new law establishes more frequent eligibility checks to make sure someone meets the requirements to receive HIP benefits. Another provision would require HIP recipients to provide documentation that they're working or volunteering 20 hours a week. Exceptions to that requirement would include someone receiving unemployment or caring full-time for a child or family member, along with someone who is pregnant, in a recovery program, or a full-time student. Because HIP is funded by both the state and federal government, Indiana needs the federal government's permission before it rolls out the work documentation requirement. That's one provision in the bill that does not go into effect right away. But advocates for Medicaid recipients worry it could lead to Hoosiers losing HIP benefits.
We estimate that should this provision be implemented, hundreds of thousands, probably about 150,000 Hoosiers, could lose their health care coverage simply because the process of reporting and demonstrating eligibility is very labor intensive and prone to error.
Also something to consider, say advocates, the big beautiful bill could put stricter working requirements in place that would supersede what Indiana already has.
And another potential impact from the big beautiful bill, the federal government covers 90% of HIP. Indiana covers 10%. Those ratios could change depending on what happens at the federal level. Scott?
Yeah, we'll continue to cover that story. Emily, thanks so much. So for a breakdown of all the new laws taking effect today, go to WTHR.com/SeenOn13. We've got a comprehensive guide posted for you there.